Hi, my name is Derek Debassige. I'm from the Chigang First Nation on Manitoulin Island. I do work with the North Shore Tribal Council clinically as a physiotherapist, working primarily with the elders population on the reserves between Sudbury and Sault Ste. Marie. The purpose of our interaction today is to run through or to provide a clinical experience, provide clinicians with an experience that focuses on the application of cultural values to the clinic service environment, and specifically looking at the medicine wheel and the teachings of the seven grandfathers as tools that you can use in your clinical practice. Now we're just going to go over a brief taste of the medicine wheel and some of its constructs, more or less because this is a lifelong journey for our people and for the individuals that you'll be servicing. Basically, the medicine wheel is a concept of oneself. It is a representation for us for a lot of our stories, a lot of our cultural background, our value system, our clan system, and it really functions as a tool or a guide that can give us a lot of different information or a reference point for a lot of our stories and our teachings. Now, above all else, I feel that the medicine wheel offers us a vision of ourselves, specifically the goal of reaching balance within ourself and in our surroundings. Now, the medicine wheel broken up into its 4 quarters represents a number of different things, and one of the teachings is that it represents the concept of that balance in our spiritual, emotional, physical, and mental aspects of our life. Now, as we look through that medicine wheel, obviously we see other people in that way, and that wheel acting as a tool to help us solve problems and to look for ways in which we either are gaining balance or unfortunately feeling ways or feeling different aspects of imbalance within our lives. Now, as a clinician, through our subjective, objective analysis and plan portions of our interaction with a patient, most often, whether you're a physician, physiotherapist, occupational therapist, nurse, whatever it may be, we have a very limited time frame to go over this whole aspect of balance with an individual. Some individuals may have 10 minutes for their interactions with one of their patients, or maybe even up to an hour. But in the grand scheme of things, it's a very short interaction with the patient that we have to try and figure these types of things out. And through that subjective and objective analysis of an individual's problems, one of the things that this tool, the medicine wheel, offers us as clinicians is one, a way in which we can acknowledge our own biases in treating this individual, and 2, a way in which we can look at the patient or the client in front of us and collect information in these areas. Now, not everyone's scope of practice includes the spiritual, mental, physical, and emotional states of a person, but through our subjective interaction with an individual, they're going to give us information along these areas, helping us to determine which area may be out of balance or require some interaction from us as from a treatment perspective. Through our objective analysis, we're going to gain more information, talking with the client, putting your hands on the client. You'll be getting more information about their physical, mental, and emotional states. And furthermore, as we start to gain an impression of the individual, we're going to start to bring together our knowledge and our specific backgrounds as clinicians to find a way that we can help these individuals. Now, further to the medicine wheel, and that looking at it as a concept of the individual and striving for balance within that clinical interaction, we have another set of tools that we can use, another set of cultural teachings that we can put into play that helps us to bring together those spiritual, mental, emotional, and physical realms, and gives us tools or aspects of treatment or components of the treatment that we can use to address and maybe help bring these areas back into balance within that 15-minute, half an hour interaction. These teachings of the seven grandfathers, and you will have looked at these in terms of the respect, truth, humility, love, wisdom, etc. These things are the ways in which we can relate our knowledge or translate our information in our treatment, whether the treatment is acupuncture, the treatment may be a vitamin B shot, it might be anything along the range of treatment, but how we bring that about and how we bring that to the individual is going to address some of these sources of imbalance that we've drawn from our subjective and objective collection of data. So when we start to identify which area of this individual or this wheel is out of balance or requiring our intervention, that's when we start to decide which delivery method are we going to use, which one of the seven grandfathers or which combination of those seven grandfather teachings are we going to acknowledge this patient's or this client's problem for that particular session. We're obviously trying to incorporate these belief systems into clinical practice. There are culturally different belief systems across cultures, across different races, and through different areas and regions. And what the literature tells us is that these culturally different belief systems can influence the way in which we conceptualize the world. And an individual's ability to access and understand and utilize these belief systems, whether we believe in them ourselves or whether we practice them ourselves, can affect the utilization of the health system and utilization of the intervention and the patient's view and perception of that intervention as a whole. I feel that these tools help us to really bring together or balance the interaction, whether it is 15 minutes, 30 minutes, whatever it may be. But essentially incorporating those elements of cultural value that are very impactful and very meaningful to our clients helps us relate better within that period of time and essentially, I feel, deliver a more efficient treatment. What does the medicine wheel mean to me? It's a good question. But I think it's the governing system. I mean, it is my system of beliefs. It's something I've been working towards for my entire life, and I feel that I'm nowhere near where I need to be in order to make decisions that are balanced, make decisions that are truly guided by that. Some of the most memorable moments I have in my life, I relate to being balanced interactions, in that they had some element of each one of those grandfathers in them, that each one of those four areas of the medicine wheel with respect to myself have been fulfilled or somewhat addressed through that interaction. It has helped me make my decisions, whether it's relationship decisions, clinical decisions, professional decisions, and making choices through where I want to be and where I want to go for a long time now. So essentially, I think it's my view of myself and the view of the world around me, and as long as I can keep that scope pointed on the things that I'm striving for, I find that with the help of those grandfather teachings, it tends to accelerate the process a little bit more. If I realize that there isn't something really going the right way or going the way I hope it to, or maybe not necessarily a successful interaction or a successful relationship, I try to figure out what area of myself is maybe out of balance, or is being affected by that negative or not so balanced interaction, and apply, even one or two of the grandfather teachings, whether it's just being truthful and honest with myself, or being humble and addressing the situation for what it is, and sitting back and listening maybe a little bit more, or maybe it might be applying some, a lesson learned in the past, or looking back to those things that we know are true, and to me those are, that's the wisdom in our lives. Then it generally tends to make that situation somewhat better. Granted, we're striving to incorporate all 7 of those things to every aspect of our life, but the reality of it is that's very difficult to do, and I think that's what the goal, I guess, is to try and strive for that balance in an unbalanced world. Just getting back to some of the things I'd mentioned earlier around belief systems, maybe in the literature, I think that as the push in healthcare towards evidence-based practice and those types of things, I think it's important to acknowledge that interventions such as establishing a truthful relationship and providing or facilitating a supportive spiritual environment, those are things that have been shown and have been essentially proven to impact a person's health. So it's not, I think, too much of a stretch to be applying these things at an early stage in clinical practice. Unfortunately, for the first 5-10 years of our clinical practice, as we're still scraping off the green, we're trying to get to a point where we can be comfortable with our own knowledge base and relate that to people. So I think that the faster we can address those deeper elements of healthcare and of practicing good medicine, that's when we really start to improve and really start to impact upon people's health. Cognitive or thought processes have a very impactful and significant relationship to one's ability to recover, or one's ability to get on that positive road towards good health. So I think that by us attempting to balance the interaction, not from our perspective or from our biases or from our beliefs, but from the individual's beliefs, and wrapping our head around that, the literature supports those types of things on a broad basis, and what we're doing here is just really trying to focus that a little bit more, so that we can specifically wrap our head around a tool and more essentially 2 tools, the medicine wheel and those 7 concepts, by bringing all of those together in a concept of the individual sitting in front of you. A lot of these concepts are cross-cultural. It's not rocket science. It's things that we know that we should do, but when it's put into a usable system that we can actually see, that medicine wheel, that you can physically look at a person through, with the idea of these 7 teachings surrounding each one of these stages of life, or each one of these components of a person, spiritual, physical, and etc., then it puts it into a usable and readily attainable framework. I think if we've got that information in our head, and we've got that down sound, it just gives us a concept to do the things we hope to impart as health practitioners, and I think just in general as human beings.